The COPE staff and I would like to welcome you to the COPE program and our supports. Our services are free of charge. You can self-refer. We do receive referrals from family doctors, psychiatrists, counselors, other mental health supports in the community, and other agencies in the community. You can also join the COPE program by going online and self-referring at communitycaredurham.on.ca. Support groups at this time are online because of the COVID-19 pandemic. However, you can also phone in to these group supports. If you have internet access, you can join by cell phone, tablet, or computer. The COPE program has more than 50 support groups throughout Durham Region, North, South, East, and West. These groups are offered morning, afternoon, and evening. There are 3 different kinds of support groups. Social recreation groups. These are folks who are isolated and lonely. There's programming that's enjoyable and fun, and an atmosphere to create community and connection. We have open and ongoing support groups where people can come weekly for as long as they need the support. Lastly, we have life skills groups, a program which we are expanding. Life skills groups have topics like self-care, self-compassion, stress management, even yoga, and many more. We also have a new group, which is a welcoming group to the COPE program. This group is to help orient you to the group experience, to answer questions you may have about the COPE program and our services, also to help you with any technological difficulties with connecting online to support groups. All group members are required to sign a support group agreement. The support group agreement has content about confidentiality and mutual respect. COPE groups are led by trained volunteers who receive 36 hours of training. Some groups are led by COPE staff. COPE groups may help fill a gap between someone's need for emotional support and clinical treatment. For example, a person's relationship with a psychiatrist or clinician may not provide adequate emotional support. A support group among people with shared experience may function as a bridge between clinical and emotional needs and well-being and recovery goals and life and coping skills. Groups are not the same as therapy sessions. There is no clinical treatment or medication management. COPE groups are not counseling support. Here are some of the benefits of COPE support groups. Feeling less isolated and judged. Reducing distress, depression, and anxiety. Improving coping skills. Staying motivated to manage treatment plans. Gaining empowerment, control, and hope. Improving understanding of symptoms and illnesses, etc. Learning about resources. The COPE staff and I look forward to supporting you on your well-being and self-care journey. Welcome to COPE.